We created this DVD to demonstrate the potential of free-end bonding in the smile frame using a special technique called the natural layering technique, which makes use of only two basic increments, dentine and enamel. There are three different procedures demonstrated in this DVD. One case of 6 direct veneers, one case with full incisal buildup of 2 central incisors, and a last case with a full transformation of 6 anterior teeth with the same technique. I look forward to share that material with you. The first case presented in this DVD is a veneer case which was realized with only composite materials. The patient is showing some severe erosive lesions and some wear of the front teeth, which are related to a period of unbalanced diet and severe parafunctions. Because of financial reasons, we decided to use composite instead of ceramics. And you will see that before the placement of the composite restorations, we have also performed a moderate surgical crown lengthening of the 4 incisors in order to obtain better proportions. I'm sure you will appreciate what we were able to achieve with only direct composite restorations, with using only dentines and enamels without even effect materials. We see the initial situation of a patient who will receive 6 direct anterior veneers after we performed a moderate surgical crown lengthening that you have seen on previous images. By performing the gingival surgery, we have obtained better proportions. Now we realize the gingival retraction, as we will not use a rubber dam in this case. It will actually be easier to keep control of the forms since we don't have the rubber dam in place. We will perform a very conservative preparation for veneer. What we try to achieve is a regular thickness of the restorative material, but without removing too much healthy tissue. Due to previous erosive phenomenon, we have lost already a certain amount of tissue so that we don't need to remove too much of it. Incisal ledges are only refined with the burr in order to achieve a good adhesion in this area. We proceed now with the shade selection after we have removed the old cervical restorations. We check all available dentines from the MIRIS system. we check dentins with a higher chroma on the left side or lower chroma on the right side. After selecting dentin, we make the choice of enamel. Here from the supreme, we directly apply some material on the tooth to be able to perform with a more accurate selection of the material. Then we can immediately place matrices on both central incisors, since we will start with the restoration of these two teeth. We start with the etching of enamel for about 45 seconds. Etching of dentin will be for about 15 seconds, since we mostly have sclerotic dentin in this area. We rinse thoroughly both enamel and dentin. We use a suction to remove the excess of water so that we do not dehydrate dentin, we keep it slightly moist. The primer is applied over dentin in the cervical areas and as well on the incisal edges. The excess of solvent must be dried off with the air spray. Then we can apply the bonding resin over all surfaces. And light cure it for about 20 or 30 seconds. We start with the first increment of dentin to replace the missing tissue in the cervical lesions. We use a micro brush to smooth the composite surface and to adapt it perfectly to the preparation. We light cure the first increment and then we do the same procedure on the right central incisor. We will not use more dentin on the buccal surfaces. Since we want to lengthen the teeth in order to achieve better proportions, we need to use a little bit of dentin to block the light in the incisal edges. We will perform the same later on the right central incisor. Now we start the build-up of enamel. We try to shape the surface as well as we can, but of course we do not attempt to develop the texture with hand instruments. The microbrush is used once again to smooth the surface. It's a very useful instrument for composite restorations. We check with the mirror that we have achieved a good buckle profile, and we still have a chance to do little corrections before we light cure the material. Matrices are removed before proceeding with the finishing of the restorations. Finishing usually starts with the proximal profile here on distal. Finishing discs are used to reshape all flat surfaces and will give the general form to the restoration. Proximal mesial profile is now created. The finishing of margins is performed with a fine diamond flame. We then continue with the shaping of the buckle profile and transition lines. We use a relatively slow rotational speed so that we can keep control of the amount of material that we remove. Diamond burrs are used to develop finer details of the buccal surface or the inside the ledges. We use only diamond burrs with 40 micron grain size. Check the profile with the mirror before doing final corrections. After performing the restoration of the first front teeth, we proceed with the texturing of the buccal surface. A fine flame is used with first vertical and then horizontal motions in order to create those little depressions we observe on the mesial and distal aspects of the buccal surface. The same burr is then moved from mesial to distal in order to smooth the whole buccal surface and remove eventually little facets which were created during the first part of the procedure. The finishing continues with finer discs, which we progressively move over the entire buccal surface. We proceed with moderate pressure so that we do not remove completely the texture which was created with fine diamonds. We proceed in the same way with fine discs and extra fine discs. In order to obtain the final gloss, a hard brush is used. This will make the surface shiny without removing any material. After completion of the first 4 restorations, the retraction cords are removed and the sulcus cleaned of any remnant of bonding resin, which would irritate the gingival tissues. The same procedures will be applied to both left and right canines. The second case of this DVD is about the buildup of two central incisors in a young woman. Those two teeth were previously treated, but the patient was dissatisfied with the aesthetic result. And the reason for that is the relatively short length of those two teeth. In other words, we have lost the dominance of central incisors, which is typical of a young smile. So we have reconstructed those two central incisors with a direct technique using a silicone index, enamels, dentin, and some effect materials. And with this relatively conservative technique, we have achieved a very good aesthetic result, as you will see. Here are two central incisors, which were previously fractured and that we want to restore to a normal length in order to get a better aesthetic integration. We normally proceed first with the shade selection, evaluating different dentin chromas. We have the dentin S2 from Miris and the dentin S1 on the left side. We then select one enamel shade that we combine to the previously selected dentin, and we evaluate the combination of the two shades together. In order to perform an accurate shade selection, glycerin gel has to be injected in between the two shade samples, so that light is not reflected at the interface. We need to define the position of future incisal edges, and this is performed by a freehand mock-up. Some light curing material is applied on existing restorations and shaped in the desired length and width. The contours are first defined with hand instruments. and then are quickly light cured. But inside the ledges still need to be refined with diamond burrs and discs. Occlusion is controlled. Before we will fix this information by the way of a silicone index. The silicone material should cover the lingual surfaces and the inside the ledge without coming over the buccal surface, as you can see on this view. The existing composite restorations are removed with coarse diamond burrs, initially with water spray, and at the end of the procedure only with air spray in order to better control the removal of the last restoration remnants. The cleaning and finishing of margins are performed with fine diamonds. We usually make a bevel 1 to 1.5 millimeter, about 45 degrees, with the two surfaces wherever possible. The proximal surfaces are cleaned with a coarse diamond strip, and the silicone index is replaced in the mouse to control its perfect positioning. Mylar strips are inserted between the teeth before we perform adhesive procedures. All enamel surfaces are etched for 45 seconds and dentin for about 10 seconds. Enamel is etched further to the preparation margins. Surfaces are thoroughly rinsed with water. And then dried with suction to remove the excess of water. Exposed dentin is covered first with the primer. Excess of primer and additional drying of enamel is performed with air spray before the application of bonding resin. Bonding resin should be applied in thin layers, especially on the buccal surfaces. Airspray is used to thin the layer. Light curing is performed only on lingual surfaces or over dentin surfaces for about 20 seconds. The first enamel increment is applied on the silicone index and then brought to the mouse, so that we can make sure that we will perfectly cover the lingual margins. A hand instrument, spatula, and micro brush are used to control the thickness of the lingual increment. This first step is very important because it will guide us for the application of next composite layers. Milo strips were kept to separate the two teeth. Light curing is performed before we remove the strip and then the silicone index. Additional light curing is performed on the lingual surfaces. We can then proceed with the build-up of the second incisal edge. A very short Milo strip is inserted again in between the two teeth before the silicone index is replaced in the mouse together with enamel. The same procedure is actually repeated now for the right central incisor. A thin spatula can help to shape the increment in the proximal area. Once again, it is very important to control the thickness of the first lingual increment, because this will have a major influence on the final aesthetic result. The lingual buildup of the incisal edges of the two central incisors has been completed, and we can start with the application of dentin. Dentin is shaped so that we maintain a little space below the incisal edge. This is a configuration of a young tooth. We define the mamelons. During the light curing, we can very nicely see the mamelons of dentin. A small amount of blue effect material is added to the dentin mamelons to mimic opalescence effects. The effect material also fills the spaces in between the mamelons. It is very important to apply only small amounts of effect materials so that we will obtain a very natural effect. We light cure separately the effect materials. We see the completion of this step. We can then start with the build-up of enamel. We normally proceed first with the proximal build-up here on mesial. We also pay attention to control the thickness of this last layer. This will allow us to reduce the time needed to perform the finishing of the restoration. Each increment is light cured separately. We pursue with build-up of the distal corner. Trying to pre-shape as well as possible the restoration with the hand instruments. Some more effect material. Here, the white effect material from the mirror system is still added before the application of the last enamel increment in the center of the tooth. With this fourth increment, build-up of the incisal edge of tooth 11 will be completed. The same procedures will be repeated now on tooth 21. Second increment is the myristentin S2. We shape the mamelons and we make sure that we preserve the space which is needed for enamel and effect materials on each side and above the mamelons. The mirror is used very often to control the application of increments in 3 dimensions. The blue effect material is applied as a very thin layer on top of the dentin mamelons and in between them. Effect materials have to be light cured before we apply the next enamel increments. To guarantee a good contact point, the matrix is held with the fingers and a plier. We maintain some pressure on the composite to allow the material flowing over the margins, at the same time controlling the contact point. We see the application of the last buckle increment. We start the finishing with the distal proximal profile, and we follow with the reshaping of incisal edges. The incisal edges are inclined from buccal to lingual, so the disc is inclined following the same angulation. Then we follow with the buccal shaping and we position transition lines. We should respect the natural curvature of the buccal surface so that we incline the disc from cervical to incisal. A flame fine diamond is used for the finishing of margins. With this instrument, we can also create finer details of the buccal anatomy, such as the texture. The texture is obtained by moving the instrument either in a vertical or horizontal direction. As we have only a discrete texture to create, we'll work mostly with horizontal movements. You see with the lateral perspective that we try to respect the natural buccal curvature, which is very important for the final aesthetic appearance. By applying a moderate pressure on the instrument and by doing movements from mesial to distal, we create a smooth profile on the buccal surface. We still need to finish the lingual embrasures and margins. Incisal embrasures are corrected also with the discs. A rebonding is performed to fill little defects we might have on the surface, such as bubbles. This is performed before we will proceed with the next polishing steps. The bonding resin is light cured. You see the final situation after polishing. You see also the dehydration of the teeth, which is quite visible. The third case of this DVD is a very interesting case. It's a young woman with missing lateral incisors and with definitive canines being at their place and decidual canines being still present with a relatively good root. So we have reshaped completely the front smile with direct bonding, with only minimal recontouring of the canines. And I think it will be interesting to see what we have achieved with this extremely conservative treatment approach. We will rehabilitate this smile, which presents missing lateral incisors. Canines are in the position of the lateral incisors, and deciduous canines are still in place but are severely decayed. A setup wax-up was performed in order to evaluate the aesthetic and functional integration of future restorations. Permanent canines need to be reduced in their mesodistal diameter. We need also to reduce the convexity of the buccal surface, since we want to reshape this restoration and make it look like a lateral incisor. This will have a very important influence on the final aesthetic result. Other instruments, such as fine diamonds, are used to complete this preparation step. The distal surfaces of central incisors are cleaned and roughened before we will apply some more composite to enlarge their diameter. As soon as we have performed the reshaping of canines and the cleaning of central incisors, we can proceed with the shade selection. We have evaluated different dentines from the MIRIS system, and now we select the right dentine chroma. You have seen the S2, now we try the S1. The dentine we need is probably very close to S1. Then we combine the S1 to white regular enamel, and we evaluate the combination of both shades. The rubber dam has been placed, and etching can be performed on the distal half of the central incisor and the entire buccal surface of the canine. Lingual surfaces are also covered with the gel, as well as the left teeth. Enamel is thoroughly rinsed. And can be carefully dried. Since no dentin is exposed, bonding resin is directly applied following etching. All the surfaces are copiously covered with bonding resin. Then the layer is thinned with a little brush and later on with airspray, since we try to avoid the formation of a thick layer of bonding resin on buccal surfaces of the teeth. The reshaping of the right canine starts with the application of some dentin to block the light in the mesial embrasure of the tooth. We can actually not build up this area only with enamel. The mesial aspect of the tooth is now rebuilt with a second increment of enamel. The composite build-up starts from the gingival third, that we can completely redesign the proximal profile of the tooth. The mesial incisal edge is approximately reshaped with hand instruments before polymerization. The same procedure is repeated on the distal aspect of the tooth until a correct emergence profile and proximal profile is achieved. We see that the tooth is presenting now a flatter buccal profile and resembles more to a lateral incisor than a canine. A compass is used to check the mesiodistal dimension of both central incisors before and during their build-up, so that we can respect a perfect symmetry for these two teeth. The matrix is inserted around the right central incisor and then stabilized with a soft wedge. Since less than 1 millimeter of space exists in between the distal aspect of the central incisor and the newly formed lateral incisor, we don't need to use any dentin composite. We directly apply enamel above the treated surfaces. The composite is pushed in between the matrix and the tissue. We must pay attention to avoid the formation of bubbles, and hand instruments do relatively slow movements when in contact with the composite material. The matrix is pulled over the composite with pressure, allowing the composite to flow over the tooth surface. The matrix is stabilized before light curing. The build-up of the two right teeth is completed. The same procedures need now to be repeated for the left canine and incisor. The same dentine and enamel shades will be used, of course, for this procedure. You see the formation of the mamelon with the spatula. One step which was not demonstrated during the reconstruction of the right teeth is the application of a very small amount of blue effect material around the mesial mamelon. This will increase the apaliscence effect in order to achieve a better aesthetic integration of the restoration. The blue effect material should not be placed above the incisal third. A very small amount is also added to the distal corner of the tooth. The effect material is of course applied before the last enamel increment. Mirror's enamel has been applied first on the distal aspect of the tooth and carefully shaped with a very thin spatula. The reshaping of the lingual surface is controlled with the mirror. The matrix needs to be applied to guide the placement of enamel on the mesial surface of the tooth. The composite is pushed in between the matrix and the tooth surface. We work with relatively short movements on the composite surface in order to avoid the formation of bubbles. The proximal profile and the emergence profile of the mesial surface of the tooth is progressively designed with the hand instruments. The matrix is held with a plier to create a good access to this area before the light curing. The distal surface of the central incisor also needs to be corrected. A single layer of enamel is added to this surface, as we have seen for the right side. Due to the limited space available in this area, a thinner spatula is used The matrix is held with the finger and applied with controlled pressure above the two surfaces. We wait until the composite has flown over the distal area of the tooth before it will be light cured. During this first step, we have restored the 4 anterior teeth, and we can now proceed with the finishing of those restorations. We always start with the finishing of the distal proximal profile of the tooth. We then recreate the transition lines which did not exist formally on those canines. The third step of the finishing is to develop a normal buccal curvature. Those anatomical elements are very important to obtain a good aesthetic result. We follow with the development of embrasures, which are much smaller than it was before. We create the correct inclination of the incisal edge, and as you can see, there is a 1 millimeter ledge in between the incisal edge of the central incisor and the lateral incisor. The transition between the composite and the lingual surfaces is refined with a pear-shaped burr. On the buccal and the cervical, transition between the composite and the tooth surface is refined with a flame diamond. And then discs and a brush are used for the pre-polishing. We see now the completion of the first 5 teeth. This sequence will now demonstrate the build-up of the left deciduous canine. We need first to remove this old class 3 restoration, clean the mesial enamel and do a bevel around this cavity, and also above the cervical lesion. The dentin surface has to be clean and roughened in order to get a good adhesion on this surface. A matrix is placed in between the adjacent teeth in order to protect them during etching and adhesive procedures. We start first with the etching of enamel. After a 1 minute period, we then cover also exposed dentin areas with the etching gel. After 15 seconds, the etchant is removed with suction and the surface is rinsed. The primer is applied on all exposed dentin surfaces, applied actively, and then the excess of solvent is removed with water spray. The bonding resin is applied on all surfaces and light cured for about 20 seconds. Dentin is first applied in the depth of the class 3 cavity to replace missing dentin. The build-up of this tooth does continue with the application of dentin in the cervical lesion. Attention is paid to adapt the composite very precisely along the margins of the preparation. We need to apply some more dentin to clothe the embrasure in between the canine and newly formed lateral incisor. Some more dentin is applied also on the cusp of the tooth, since it has to be lengthened. Actually, enamel only cannot be used for this purpose. Enamel is now applied on the distal aspect of the tooth. The entire buccal profile and distal emergence of the tooth has to be reshaped. We try to give the tooth an ideal shape that we will save a significant amount of time during finishing. The same procedure is repeated on the mesial side of the tooth. The matrix, of course, helps to separate the two teeth and develop a nice proximal profile. Some more composite is added on the cusp of the tooth. This will give the tooth its character. The build-up of the tooth has been completed and the finishing is starting. Once again, the finishing starts with the proximal profile and then does continue with the reshaping of the buccal surface. A careful finishing of lingual margins are performed. Polishing is performed with finer discs and the hard brush until a perfect gloss is achieved. Occlusion is controlled, and we make sure that we have regular contacts and a group guidance to avoid possible fractures of the composite material. The build-up of the 6 front teeth has been now completed.